But anyways, we're gonna go in. We have two guests with us today. We've got Dr. Laura Corman, who's coming to us from beautiful Florida, and then I won't call the next guy beautiful, but we'll call him Randall Chestnut, who's coming to us from Texas as well. And we're going to touch just on a couple of different subjects that we thought would be helpful to have everybody here right now. So I'm going to introduce Dr. Laura. So Dr. Laura is she's a chiropractor. She's got a diplomate in nutrition. In fact, she's got over 600 postdoctorate classroom hours in nutrition. Man, that's impressive. She's been a diplomate in nutrition for the past 20 years. She's an AF&I, Applied Functional Neurology Institute graduate, which I'm proud to say I am too, through Dr. Andy Barlow. And she is considered a ketogenic lifestyle expert, which I can really, really appreciate since I'm a ketogenic guy. That's a lifestyle that I go by. So, and she's developed 2 different lifestyle programs, and I'll kind of let her talk about that a little bit. So, Dr. Laura, thank you for joining us today, and how you doing out there?
I'm doing very well, Rob. Thank you for inviting me. And yeah, I know it's all about COVID-19 and what do we need to do to keep our immune system strong, and what do we need to do as doctors to teach our patients, right? So I'm going to be talking about the 3 overlooked signs that your immune system may be struggling. And so the definition of the doctor is docere, which means teacher, right? So there's never been a greater opportunity for us to rise up to that occasion and be the teacher that our patients need right now. And so in order for us to be the good teacher, we need to walk the talk, right? So we need to fix ourselves first. So we need to fix our own immune system. So we're going to do an immune system makeover, or maybe an overhaul for some of us here. So before I wanted to say too that our best defense is our own defense, right? So we're told to use the sanitizers and the masks and everything, but our best defense is our own defense, our own immune defense. And Brandon Brock just said the other day, he said, we need to get healthy before we get sick. And I love that. So we don't want to wait till we get sick. We need to get healthy before we get sick, because this COVID-19 is not going away. It's a virus that mutates, and it'll rear its ugly head again. And we need to be ready. So we need to arm ourselves and get our immune system strong so that we can optimally strong so we can fight this and be ready for COVID-19, COVID-20, COVID-21, or whatever else. So I wanted to talk to you about an interesting study that came out of Italy, and out of all the people that died of COVID-19 in Italy, 50% of them had 3 or more comorbid or coexisting conditions. 50%. Another 25% had 2 or more coexisting conditions. And then another 24% had 1 or more coexisting or comorbid conditions. Only 0.8 people who are dying have no known coexisting conditions. And that's pretty amazing. So healthy people are really able to kind of beat this thing, right? Yeah. And so the conditions that were coexisting in these cases are obesity, heart disease, and diabetes. So these are all chronic metabolic illnesses. And we know that 80% of the chronic illnesses are lifestyle induced, which means they can also be lifestyle managed, which is a pretty good thing, right? So the #1 cause of a weakened immune system is insulin resistance, okay? Metabolic syndrome or prediabetes. And insulin resistance is an epidemic in our country. And it is the precursor to obesity, diabetes, and heart disease. It's the common denominator in all those chronic illnesses. And so these people who have insulin resistance are more likely to, have these chronic illnesses and succumb to the demise of this, or have complications of COVID-19. So we need to manage insulin resistance. 40% of Americans have insulin resistance, and this is including doctors, by the way. And most people are unaware of it because the tests are really insufficient to diagnose. The typical annual panels are relying on a fasting blood sugar of over 100 to diagnose prediabetes. Well, if we've been fasting for 10 hours, I would hope that our blood sugar would be below 100. It should be below 100 2 hours after we eat, not 10 hours after we eat. So if our blood sugar is coming up over 100, we probably have had insulin resistance for quite a while. So a better test would be looking at your hemoglobin A1C, which is a 90-day average of blood sugar. But even better would be a fasting insulin. That is very rarely tested. So I want all the doctors to get their fasting insulin checked, and we want it below 5. Okay, so if that fasting insulin starts creeping up over 9, 11, 14, our body's having a harder time driving that blood sugar into the cell and keeping that blood sugar at a normal level. Okay, that's early insulin resistance. The other signs of insulin resistance is abdominal obesity. Okay, so when we start carrying some weight around that middle, I think it's 40 inches for a man and 35 for a woman, that's a sign of pre-diabetes. When we start getting triglycerides over 150, when our HDLs start tanking below 50, and when our blood pressure starts coming up over just mildly, even 130 over 85, these are all signs of insulin resistance. So we need to watch these things and get a handle. I'm going to talk about how we manage that when I'm finished with these other two signs. The second overlooked sign of a poor immune system is a leaky gut, right? So 80% of our immune system is in our gut. It initiates in our gut. And Americans are abusing Tums and Prilosec and omeprazole. They're over-consuming processed food, GMO, and inflammatory foods. They're overprescribed antibiotics. They suffer from chronic constipation or diarrhea, and our guts are a mess. And so if our guts are a mess, our immune system is a mess. Okay, so we got to fix our guts. And the third overlooked reason for our immune system that may not be functioning properly is actually due to an overactive immune system, and this is autoimmunity. Okay, and so this causes a lot of inflammation, and inflammation is no good when we're fighting a virus like COVID-19. So as you know, autoimmunity is when our bodies are attacking self-tissue, and we get this heightened activation of antibodies resulting in overproduction of these inflammatory cytokines. And this is particularly problematic for this COVID-19 because this excess inflammation is not only damaging lung tissue, it's damaging brain tissue. Okay, the microglial cells are getting damaged, and so this is why one of the first signs of the corona oftentimes is a loss of smell. So it's affecting the brain. It's a brain-based issue, that loss of smell. So let's talk about what we can do about these things. See these three things, and so we can improve our own defense and our immune systems. And the first one, number one, is to get off of sugar and processed carbohydrates. So sugar directly depletes our macrophages, our white blood cells' ability to fight infection. And they're addictive. And so especially now with people maybe at home more in front of the TV, they're having a tendency to grab for more processed foods, and this is not going to be good to strengthen our immune system. So we want to get off the sugar and the processed carbohydrates, and we also want to say no to gluten. For most people, gluten is an inflammatory protein. So even if you're not celiac or if you don't have gluten sensitivity, it's still an inflammatory protein, and most wheat derived from wheat is the wheat products are killed with glyphosate, so they get 2 growing seasons. Now we have that toxin in that wheat as well. So especially if people do have gut issues, or if they have resistant weight loss, allergies, asthma, any autoimmune condition, skin conditions, migraines, or chronic bilateral pain or numbness, gluten, which should really be eliminated. We also want to stay away from any of the genetically modified foods, which is all corn and soybean and most sugar cane in this country, and artificial sweeteners, because both of these things will destroy the natural microbiome, the natural healthy bacteria in our guts. Vegetable oils, which we find in dressings, mayonnaise, sauces, including soybean, canola, and corn oil, are inflammatory. They raise inflammatory, they're omega-6 oils, and they make us more inflammatory. The other thing that we need to do is to drink more water. So we take our body weight and we divide it in half. That's how many ounces of water we should be drinking a day. So, and for every cup of caffeine or soda or alcohol, we need to add another cup on there. So we need to stay hydrated. We need to get some exercise, especially aerobic exercise, maybe 20 to 40 minutes, 5 or 6 days a week. Making sure not to really overdo exercise. I know a lot of people think, oh, the more I do, the more I can eat, or I kind of compensate for a bad diet by over-exercising. And actually exercising in excess of 40 to 60 minutes, high intensity, can raise cortisol levels. And those cortisol levels then can spike sugar, glucose levels. And then there you go, increasing your, your insulin production, insulin resistance. We want to get outside in the sun. That's our natural best source of vitamin D. And those healing rays, the infrared rays, the far infrared, are very healing to our cells. We want to make sure we're getting 7 to 8 hours of good quality sleep. One night bad sleep can increase insulin resistance for the next day. Yeah. So, and managing stress, we're all, uncertain maybe about, our future economy and getting back to work, and what that's going to look like. We're not quite sure, right? It might never be quite like we used to have it. It might be a new normal for us all, right? So it is stressful. So we need to make sure that we're managing our stress levels, keeping our attitude positive, an attitude of gratitude, staying in prayer, meditation, deep breathing exercises to keep those cortisol levels managed for us. Some supplements that are beneficial for our immune system include vitamin C. If we want to take that higher dose of vitamin C, we want to make sure we do a buffered powdered vitamin C or liposomal vitamin C, getting that up to maybe 3,000 to 10,000 milligrams in divided doses throughout the day. Vitamin D. Vitamin D is another epidemic as far as deficiency is concerned. And most people probably would benefit by maybe 4,000 to 5,000 international units a day. Everybody's different depending on where you live and how old you are and what time of year it is. But you want to get your vitamin D tested. So this would be the second thing I'd like you to all get tested, your vitamin D. If you haven't gotten it tested, you want your levels up to between 60 and 80 nanograms per milliliter. Okay, the range is 3,200. You want yourself in the middle, about 60 to 80. Especially when you're trying to strengthen your immune system. If you have any autoimmune challenges or if you've had cancer, you want those levels up nice and high. Okay. Zinc, probiotics, monolaurin, which you get from coconut, monolaurins from coconut, and colloidal silver, natural antimicrobials. Now, I talked about the inflammation on the brain, and so some supplements that can really help reduce this brain inflammation are liposomal glutathione, curcumin, and resveratrol, as well as DHA from fish oils. Those are the 4 top supplements to help, protect your brain. Okay. And for those of you that do want to take a deeper dive into a ketogenic lifestyle, I don't really like to call it a ketogenic diet because it's not about a diet, it's about a ketogenic state. It's about the state of ketosis. And I can have a young male athlete eat over 100 grams of carbohydrates a day and stay in ketosis. And I can have a postmenopausal woman eat 20 grams of carbohydrates and she can't be in ketosis. So it's not about macronutrients per se. It's about your insulin resistance and how resistant you are to process carbohydrates. And so, but the state of ketosis, that ketogenic state, is very neuroprotective. It actually protects our brain. It lowers inflammatory markers. And so it's very protective. And so the one thing you can do to get started is to maybe, for men, to reduce your carbohydrates to 50 or less, unless you're an athlete, and a woman to reduce your carbohydrates to 30 or less. Moderate protein. This is not an Atkins diet. So your moderate protein is going to be for women maybe 50 to 60 grams of protein, and men might 70 to 90. Again, when you're in a state of ketosis, it's muscle sparing. You're not breaking down muscle tissue because you're not in glycolysis, right? So, but when you lower carbohydrates, you need to fuel your brain with healthy fat. So you need to get that fat content up to fuel your brain. There's avocados and olives and olive oil and avocado oil and macadamians, pecans, walnuts. If you can do some grass-fed ghee, maybe some grass-fed butter. If you can do some cheese or dairy, you can throw that in. But what's interesting is that the ketosis was shown to reduce 3 inflammatory markers that are known to be elevated when someone has COVID-19. That's interleukin-6, C-reactive protein, and insulin. All those are lowered when you're in a state of ketosis. And I found that very interesting. So it's a lot of people misunderstand this, but it's a very, it's very ancestral. And you can also try intermittent fasting. I was talking to Rob about that just yesterday. And so intermittent fasting is we're just going to push your breakfast a little bit closer to lunch, because it's during this fasting time where our body is cleaning house. So we can't be eating food and digesting food and cleaning at the same time. So when we're fasting, we're cleaning house. When we're cleaning, we're destroying damaged cells, damaged cancer cells, fighting pathogens, increasing BDNF, which is nutrition for our brain. It's a very, very wonderful state. So the magic happens during this intermittent fasting. So if you want some more advice on this, I'm glad to help any of you with that. You can private message me or call me. My cell phone, 941-928-3460, and I'll be glad to teach you more. That's it then. So the three ways that our immune system struggles: insulin resistance, poor gut, and inflammation, possibly due to autoimmune. But guess what? We have the power to change our lifestyle so we can keep our immune system. We can fight this thing.
Yeah, thank you. You know, it's funny. I've been doing this type of lifestyle for, how long ago did we meet? We met several years ago.
I think it was in 2016.
Yeah, so at least 4 years ago. So I've been running this lifestyle for quite a while, and we were just talking the other day. So I eat my first meal about 2:30, 3 o'clock in the afternoon every day, and then I eat till about 7:30, and then I shut. So I only eat for about 5 hours out of the day.
And that's a pretty short window.
Yeah.
Not everybody can do that. Not everybody needs to do that, especially every day. You can cycle in, have some good complex carbohydrates, maybe once or twice a week in there, and allow yourself to indulge in those. That keeps things balanced. A feast and famine type thing going on. And women might not be able to take that quite long of a fast. I know that's a little, I mean, some days I can, but it's a little bit long. Most days, if you do it every day, for most females, it'd be too long.
I think Linda wanted to ask something. Let me find out here if she can. Trying to pull her up here. Won't let me. I don't know why it's not letting me on, Linda. So if you had something, you can post it up on the chat, and I'll ask it. So.
Okay, can you hear me?
Yeah, there you go.
I'm sorry. I just was wondering if Dr. Laura, if you would repeat the supplements for brain health.
Oh, sure. It's a liposomal glutathione, curcumin, resveratrol, and DHA.
Okay, awesome.
From fish oil.
Thank you so much. I appreciate it.
You're welcome.
Yeah, and thank you so much. We appreciate you coming on, giving the time to do this. And I think the biggest thing that I see with a lot of docs is they may preach a healthy lifestyle, but a lot of them aren't living a healthy lifestyle. And I go to a lot of chiropractic conventions with Ergo-Flex, and man, sometimes I'm shocked at the way a lot of the doctors look. And so, but I'll tell you, I've met a ton of doctors through the AF&I, and it seems like most of the people who have been through that. And I love Dr. Barlow's take on gluten, right? Gluten's like the worst thing in the world, especially on the neurological steps. It just wreaks havoc. So, it's pretty cool that, I've been preaching this stuff for a while, and I've enjoyed it. And, it's a pretty easy lifestyle once you settle in. So thank you so much. I appreciate that. So I got to figure out how to get me back to host here. Let's see.
Are you going to mute me then?
I will mute you. How's that?
Okay, thank you.
You're welcome. But I got to get the host off here. There, more. Hey, Randall.
Yes, sir.
Okay, man, it's not letting me pull host back. How come? Maybe does she have to put me at host?
You don't have to.
Okay. We
I
good?
think you should be good. As long as you get here.
Quick question somebody asked. I want to make sure I don't forget to answer this real quick. I had somebody ask that if you're seeing patients face to face, could you speak about PPE, so personal protection equipment? So the CDC right now is recommending if you're seeing patients, you should at least wear a mask. Okay. It's a matter of preference, what you want to do. I don't like wearing a mask. I don't wear a mask in my office. I don't wear gloves. I wash hands between every patient. I don't like gloves because I got to throw them away between every patient. So if you're wearing gloves, you got to make sure you don't touch one patient then the next. So you got to throw them away between every patient. And I don't know if you look at the price of gloves lately, they're a little bit pricey. So I choose to just wash my hands between patients. And if you don't have access to a sink in your room, make sure you're using at least a 60% alcohol-based hand sanitizer. So, it's a matter of preference. I know a lot of doctors that are using different types of face masks and so forth, and some aren't. It's really just a matter of preference of what you want to do. I don't think there's a right or wrong answer to that, but the recommendation from the CDC is they're recommending face masks. And I think they're recommending face masks anywhere in public right now. We just had a county south of us just went to mandatory face masks. The county I'm in is not. I think it's $1,000 fine if you don't have a face mask in public in Harris County in Texas now. So I just wanted to kind of address that real quick. So our next guest, Randall Chestnut. So, man, if you guys ever get a chance to meet and talk with Randall, I can tell you that, man, you're going to have a lot of fun. I mean, he's exciting. He does a bunch of different web type stuff, webcasts and podcasts, and man, he's just fun and exciting. And he's got information on us about how to do a video properly. So I know there's a lot of people out there that are nervous about doing videos, and right now that's probably the best way we have to reach our clientele. And I'm going to let Randall kind of get into that. So, but first of all, Randall, man, how you doing today?
Hey, man, I'm not bad for a Thursday. I thought it was actually Wednesday.
Yeah.
I looked on my phone and said Thursday. No, actually, I was listening to a podcast, and it normally comes out later in the day, and it said Wednesday. And I'm like, wow, their podcast came out early today. And then I realized it was Thursday.
So, man, you just got back from doing some camping. How'd that go?
I did. I was out enjoying nature up by Dallas and on the lake. So that was good. Kind of get your thoughts and get away from watching the news because, media is there for entertainment purposes now.
I heard you could teach me a thing or two about fishing.
I think I can now.
That's good. Okay, man. So tell us a little about what you do real quick. So you just kind of tell us a little bit about your business and what you do.
Yeah, I always use this. It's because a confused mind always says no. So without confusing anybody, I give you the simple version. If you were wanting to build a home, and you and your wife or your spouse decided that you were going to build a house, a custom house, the first person you would go to is an architect. You wouldn't, call up a floor, or a roofing guy and said, "Hey, I need a house," because he couldn't help you. I mean, he could probably do something, but it wouldn't be a house. Or build you a bathroom, or like, "Hey, I need somebody to build me a bathroom." Well, I need a house first. So what I do is really that I architect the whole their whole marketing, from their email to their Facebook, kind of come up with the whole strategy, because that's where you should start always. I mean, it's kind of like a doctor. Somebody calls you and says, "Hey, doc, my knee hurts." Like, okay, well, there's a lot of questions and a lot of things, and just because you think it's your knee, it's not necessarily your knee, right?
That's right.
So, much like that, you have to really dive in and actually back out of that and go to a higher level. And that's really what I enjoy doing. In fact, I took on the architect of marketing, because that's the first step in doing it. And then hiring the people that could do all of that's a good copywriter and a videographer and a graphic designer, all of those. Not one person can have all of those skill sets and be excellent at it. It really takes somebody who's specialized. So I really like operating in the higher levels. I've worked with Fortune 500 and publicly traded, and then local businesses. So it's all the same. It's just more zeros behind the bills that they have.
So Randall does all the marketing for us at Ergo-Flex. He does a fantastic job for us. So, and we really appreciate that. And I actually get the pleasure of seeing him in the office. He comes in the office quite a bit. So I've gotten to know him, so I consider him a good friend as well. So tell us a little bit about what you're going to talk about today.
One of the things that, with all of what's going on, and video's nothing new. I mean, videos it goes back into, from the really Kennedy and Nixon. That was when you really seen how television could change people. That Nixon looked like he was nervous, and he was going up against a good-looking tan guy, and people just voted for him because they thought he was a good-looking guy at the end of the day, and he didn't seem like he was a crook. So video's nothing new, but more so now than ever, especially for the doctors who are, chiropractors are locally based. I mean, usually the people that they treat are in their communities. Very few people are going to drive 500 miles to a chiropractor. Not that they wouldn't, but they are, for the most part, it's a locally based. So you really have to help your community get to know, like, and trust you. And the best way to do that is through video. So talking to Linda and of course you, one of the things that I thought would be a good thing to talk about, especially when you're doing more virtual care or virtual health or virtual visits with people, you have to get comfortable with being on camera because it's a huge difference. You may be confident with somebody in person, but when you're talking to a camera, you're talking to a camera. So it's harder to emote emotion, empathy. You really have to consciously think about those things because the person on the other side needs to feel it. It's like if you've ever acted in television and you go watch like actors in real life, their facial expressions are so overdone in real life, but on camera they're not. Yeah. So video was something that you get confident at doing video. You really have a leg up on the competition, and some people are better than others naturally just because they love to talk or love listening to themselves or looking at themselves like me. But even inside of that, you have to understand that you have to give the viewer a format that they can clearly understand. So, and that requires a little bit of effort in the front part, and that's really for everyone who came on here. If you didn't get it, please let us know. I created it's a simple 5-step video template for chiropractors, but it works the same for everyone. And it's like a good movie, right? A good movie draws you into the story, right? So a lot of mistakes, for example, if you don't tell a good story. First off, if Hollywood tells a terrible story, they maybe made an awesome job in the trailer, and then you go see the movie and you go, it was nothing like the trailer. The trailer had all the good parts. Yeah. Right. So you have to deliver on the back end too, but you have to make a really good trailer is what I kind of like to use it. What these videos that you produce. One of the things that you'll see that you'll improve as you get good at videos is your no-show rates. And you say, well, why is that? The first thing is the reason that people see you come through their news feed. They didn't go to the news feed to see Randall or to see Linda or Rob or Laura. They went there to look at something else. But you interrupted them with that, and they go, well, wait, I do have knee pain, or you know what, I do need to watch what I eat. What is this? So they click on it, and they immediately, if it's a video, they listen. They go, wow, that makes sense. But I don't really know who this person is. But I'm going to sign up, and I'll research him or her later. But like most things in life, people get busy, and they don't do the research. So that's where follow-ups, like follow-up campaigns, retargeting, does that for them. That you do the following up and you tell your story and get them to like, know, and trust you on your own, right? So that's the number one reason why people sign up. And if you're in the attendee, and just put in a number 1 if you've ever had people say they wanted to come to your clinic and for an appointment and they didn't show up. You let everyone know that you're not alone. It happens to everybody. Yep. And the majority of the reason is they didn't do their research, so they don't trust you. They don't even know you. In most part, if they haven't been to your clinic. The second reason that they don't come is because they don't know if what you're talking about is going to work for them. So you have to do a good job at the follow-up, again, the retargeting, and surround them with other content. That they go to LinkedIn and they go to YouTube, because they just watched your video on Facebook. So now you just can build out a retargeting campaign. Just like when you go to look at a pair of red shoes, and all of a sudden the red shoes is in your email. It's everywhere you go. Like, buy these red shoes, darn it. Yeah. So what a good marketing and a good doctor would be like, if somebody went and they watched my ad, I now have to build trust with them. I now know that they've watched this video, whatever video is, whether it was a live feed, or it was an ad that you target with them, a Facebook, or even through email. You can know if they open the email. There's software that lets you know they open the email. And now it's your job to introduce yourself to them more and more and give them a little bit more value every time. And now they get to know you, and now they see that, oh wow, this keto stuff is nothing like I thought it was, or wow, it's not as hard or complicated as I thought it would be. I don't have to change my whole lifestyle. That's cool. And then the last thing is seeing someone's facial expressions. I mean, it's just a human condition that we all have. You know, it's like, I mean, if you're married or a male, you know, a female can look at you in a split second and know that something is not right just by a facial expression or the sound of a voice. So using video gives them to feel like they know you a lot better. Their facial, like, oh wow, he looks kind of like my buddy, or he talks at the same rate or speed as my friend, and they feel like they know you. So those are the 3 reasons why you would want to do video, because it would improve your show up rate for people that did.
Hey, Randall.
Yes, sir.
So the other thing, I mean, there's just not a lot of people doing video in period, isn't it? Isn't that true?
There are a lot of people. There are a lot of people. Laura does a great job, by the way, on her video. I watched a lot of your stuff, and you do a great job, and you're natural at it. There are a lot of people doing video. They're just not doing it properly.
Okay.
And you know, I should back up. There are a lot of people who haphazardly do it, and like you know, in life, if you do anything halfway, you get half of that as a return. You got to go all in. You got to commit to it. If you're going to do it, and everything in life is you have to commit to it, because that's how you start, and consistency is how you finish. If you don't put those 2 together, it never works. And then you have to trust the process. That you make one video, and if it doesn't produce what you think, I'm like, it's one video.
Yeah.
It's one video, right? And the cool thing about video is you eventually get very, very confident in video, so that when somebody calls you in the last second, say, hey, I got a spot on my show, can you come in? Like, yeah, of course. You're not nervous about it. You're not thinking about it the whole way, and then they turn on the cameras and you think millions and millions of people are about to reject you. So now that I sold the idea on why video is so important, I want to point out the 5 steps, how you use the 5 steps, and they're super easy. Once you have done it a few times, you can actually walk through it in your mind, the 5 steps, and make sure that you cover it, and you can do it in a video ad. So for people who download the template, that is the template that I wrote, that I used, was just for one purpose, you know, like that you could use it to create an ad. If you've seen that, where I walk you through how you get people's attention, walk them through, but you can use this same step for a testimonial, because testimonials is where I see people lose the most. Testimonials, when you say, hey, this is Randall Chestnut with ABC Chiropractic. Hey, I'm sitting here with Randall and he hurt his knee. Hey, Randall, tell them about your knee and how it was when you came in. Do you think that person cares about that person? They don't even know who that person is. They don't even know. You haven't even given them a story to go into, right? So you have to treat the testimonial the same way you treat this video. The first thing you have to do, and the first step, is to grab people's attention. And if it's a bad movie, if you've ever went to Netflix and you started a movie and you watch it for like 15 minutes, if they don't grab your attention, you back out and you go pick a new one, right? That's exactly what we can do these days now. We back out and we go find something else. So you have to draw them in, and you have to start the story, because once the story or the curiosity or whatever it is, we're humans. We got to know. Curiosity killed the cat, but for a while there, I was a suspect. That was an old Stephen Wright joke. So the first thing you need to do is be able to grab their attention. And you can do that in a number of ways, but usually it's that you state what it is that you're about to, something that would, usually you can state like the problem. Like, do you suffer from, you can fill in the blank, whatever that problem may be. Are you embarrassed about going to the, going out in public because you're bald? Whatever that may be. It's like, yeah, that's me. You have to start a story. Well, stick around because I'm going to share with you X, Y, Z, right? You have to start a story that they have to have finished. It's kind of like if you watch the Property Brothers, right? They start the story and they find this ugly house. And now you stand there for 45 minutes, 30 minutes. You got other things to do because you want to see what the house looks like when they're done.
Yeah.
And Chip and Joanne? Is that who it is? The other ones, the ones in Waco, Texas there. You're like, I got to see what her great work is because she does a great job. They are not themselves natural at it. That's what they have producers and people tell stories, right? So the first step is you have to be able to grab their attention. And then you have to be able to state the problem. That's the second one. State the problem that you're about to talk about. You have to draw people in that, like, if you don't have that problem, that video is not going to work for you, and it won't matter because at the end, the solution that you have for that problem, that wouldn't have been a good client for you or a patient for you anyway, right? So that's why you start it off as like, that's me. They see them, you grab their attention, whatever. Some people sing in the beginning. Some people do crazy things, blow up balloons. I know there was a lawyer one time. It was a copy machine, and he had it in the middle of a field, and he was hitting it with a baseball bat. And this was years ago, and if you've ever had to deal with a copy machine in your office, you've wanted to do that to your copy machine at least once, or a fax machine, depending on how long you've been in business. So that was the way he got their attention, and then he went into stating the problem. So restating what the problem is that you're about to talk about, and then agitate it a little bit. Like, do you suffer from, do you wake up in the middle of the night, your feet are burning, you can't go back to sleep, and you feel like you're waking up your spouse and she's not getting a good night's sleep, and you end up sleeping on the couch because you don't want to wake her up and your back hurts, so you start agitating, talking about real stuff, this is real stuff that people do. I mean, they care about their spouse. They go sleep on the couch and they go, I do that. He's like, and then you sleep in there, and then you turn on the television, and then the next thing you know, you're in the kitchen because you're up in the middle of the night. Now you're eating food. Now you're gaining weight. It's like all of these are stories that truly happen that people can relate to. And he's like, well, you don't have to do that anymore. I'm going to share with you, and then whatever your solution, which is the step number 3, what is your solution for that problem? Now, this is the part where you have to be a little bit creative in your solution, is that you don't want it to sound like everybody else's solution, right?
Right.
So the tip that I like to give people is Starbucks sold the same Arabica beans when they started selling $5 or $4 cups of coffee that you could buy at the gas station for 50 cents. It was the exact same Arabica bean fields that they would buy it from. The difference was that Starbucks didn't sell coffee. They sold a home away from home, an office away from an office, a place to do business, and that is $4, right? So they were selling experiences. So when chiropractic offices start thinking more about what is the experience that you can give, that's what makes you unique. I mean, if you're using the same techniques that you learned at the same school with your buddy down the street, he went to the same college, maybe even the same time. He's gone to Trigenics, and you name the other 50,000 other different, and they got the same equipment. He can say the same thing as you, or she can say the same thing as you. What you can do is build a different experience in those people. Like, what is it like? What do you do? Do you send them something? Maybe you send them something, or a thank you card. Or, I mean, there's all kinds of ways that you can make yourself unique. And start thinking about, that solution. And then you have to share proof. And this is a tough one especially for newer chiropractors, or maybe you've kind of pivoted your practice and now you're focusing on something that you just started. Maybe you didn't do functional medicine before and you just did straight chiropractics. So you don't really have testimonials, and you're just going to have to at least convince somebody to come in, maybe your brother, uncle, cousin, or somebody. You can get somebody. Testimonials are going to get you there, right? And the last thing is although everybody hates being told what to do, if they give you their time and there's something that they need to do, you need to tell them what to do. Like, you need to, Mike Lindell, the guy, the My Pillow guy, I mean, think about it. He made $410 million last year, and all he did was ask more people than anybody else on the planet to buy a pillow. Because you can buy a pillow everywhere you go. You can buy a pillow at Bath & Beyond, Target, Walmart, Macy's. There's pretty much everywhere you go, you can buy a pillow. But for some reason, he's selling more pillows than all of those people combined. And the only reason is because he asked more people to buy a pillow. At the end of his commercial, he's going to tell you, and buy one of my pillows. And if you buy one now, I'll give you an extra one. Or another one for $60, whatever his offer may be. And if you go to his website, it's the same offer. If you get a mailer in the mail, it's the same offer. If you see a Facebook ad, it's the same offer, right? He built that campaign. And he built his name off of My Pillow, but now he sells Giza sheets, which, by the way, the Giza cotton is just Egyptian cotton. He changed the name. That's the only place in Egypt that you get that cotton is the Giza region. And it's silky sateen. You see how he did that?
Yep.
And then lost my train of thought. That's what happens when you got ADD. Oh, so the final step is you need to tell people what to do. They want and need your guidance. You just spent maybe 5 minutes explaining everything they have, and the worst thing that you could do is tell them, hey, thanks for paying attention, and not tell them to do anything. Like, tell them to call your office, tell them to email you, tell them what you need them to do, and the people that that you related to will do it. Then then when they actually do something with you, maybe they engage with you, you told them to, give you your email. Now it's your job to prove to them that you're trustworthy and prove to them that whatever it is that you just told them, that is actually really going to be good for them before they actually come into your office. And video is the best way to do it. I mean, we have technology now that we don't even use. Like you as a chiropractor now, just think about 15 years ago. If you wanted to have a television show, how are you going to do that as a chiropractor? Just think, I'm not asking you to answer. You could just think, you could probably answer that question. You have to have a lot of money. You have to have a lot of talent. You have to have connections, and you have to give away half your life to get on television, right? It was going to be very expensive, and very few people could achieve that. If you wanted to have a radio show 15 years ago, it was a little easier, but you still had to have a lot of money because it was super expensive. Nowadays, you can do all those things 100% free, or you can have a podcast. That's just on-demand radio, and that's what people listen to anyway. Who listens to a normal radio anyway? People still listen to talk radio. And if you want to have a television show, you can produce a live YouTube and Facebook show fairly easily. And then you just have to be entertaining. That's it. So that is my 5 steps, and I'll cover them again. It's you have to grab people's attention. You have to restate the problem that you're talking about. You have to explain your solution in simple terms, try and to avoid anything that's outside of what a 3rd grader. If you were going to tell a 3rd grader what was wrong with their knee, that's how you have to tell it in your video, because nobody knows what a sublunates, I can't even say it, or a medial collateral ligament is. It's the outside of your leg, or is it outside or inside? Is medial outside?
Inside.
Inside. Okay, see? So nobody really knows that. So you have to talk in the language that your audience can understand. I mean, just like I opened up, a confused mind will always say no. Yeah. Unfortunately, chiropractors are highly intellectual people, and they talk at a high, especially because I listen to you guys talk amongst yourself, and you guys get really in the weeds and nerdy about just a simple nerve. Right? But when you're talking to a consumer, you got to keep it like you're talking to your child, where they could understand it. And we unknowingly do that because we feel like we need to show them that we know these big fancy words. And people don't, let me end with this. People do not buy the best product. People buy the product they understand the best, or the service that they understand the best. So using this template, it gives you a higher standard to yourself and to them to make the best shot at them understanding what it is that you're trying to convey to them, and if it's good for them. So, man,
that's great information. Thank you so much. And there's in the email that you should have gotten a packet. So if you didn't get that, you contact us at Ergo-Flex, and we'll make sure you got that. But you should have been able to download that. and it's got the
Yep.
5 steps. And so, if you haven't figured it out, it spells out great.
And and then I wanted to say this is because I did touch on, I didn't cover it enough. The testimonial videos, right? A testimonial video is first off, it's very difficult to get a patient to do anything because they don't like being on camera either. They like being on camera way less than you, especially if you're asking them like, hey, how'd that ED appointment go? Like, I don't want to tell everybody in the planet that I had ED, right? So you have to figure out a way that in those cases, when you're doing a testimonial, maybe you don't have anybody on camera, that you just say, this worked for Roger. He's a 63-year-old retired firefighter who had peripheral neuropathy from his diabetes, and this is what he said. So sometimes they don't have to actually be there. You can fill in the blank, but always do it in threes. Everything's done in threes. I don't know why it is. Small, medium, or large. Life, Liberty, and Levant. I'm just kidding. That's a show. But you get the point, right? It's threes in everything and threes in design. When you're considering creating a testimonial, you can use the same template, and because the whole idea is you want people to actually listen to the testimonial. So
yeah, there's too many times, man. I've watched people's videos, and sometimes you're like, what the heck are they talking about? You have no idea what they're talking about. And the other time, it's funny you talk about the 15-minute Netflix. I got about a 5-minute. If you can't grab my attention the first 5 minutes of a movie or a book, man, I'm out of there. So yeah, I was at a conference one time. I think they said with millennials and these young kids nowadays, you have 7 seconds to grab their attention.
Right.
That's crazy. Absolutely crazy. So hey, Randall, thank you so much, man. We appreciate you giving your time to come on and give these tips. There's no better time if you have never done a video. Most of us are a little bit slow right now. You really have no excuse not to. Pick up a camera. I don't care. Use your cell phone, anything, and just start talking to a camera. Because I'm telling you, the first time you talk to a camera, like Randall said, it is a totally different animal. I actually speak at my church, and I've never spoke to an empty church until this thing broke out. And when you're used to people talking or getting some type of reaction back and you're not getting anything, it can create some dead space and some difficulty. And you're also going to find out, you say and all weird sounds that you don't mean to. Yeah. By watching your videos, it's going to help you clean that up. And don't worry about that. We all do it. We all start off like that. And, you'll see people will be sitting there and they'll have these tics and they move constantly. And so you watch me. If I do a video standing, I tend to walk a lot. But that's me in life. I don't like to stand still. So
I'm glad you pointed that out. That's a great point. I tell people always go back as hard as it is to listen to my voice. I mean, I got a country voice. You listen and watch yourself, because like you said, you'll go, wow, I didn't know I was spinning around in my chair, because it gets distracting.
Yeah.
Or I didn't know that I was putting my hands up on my face or doing those. So that's a great tip there, is just to go back and force yourself to watch your video and make notations. Like, I need to, like you said, you'll say the verbal faux pas of or you stutter, which people start losing confidence the more you do that in what you're saying, because they feel like you don't know what you're talking about, even though it's really just because you're nervous.
Yeah, and the more time you get in front of a camera, the less nervous you get, right?
Yeah.
And the other thing is watch people who put out good videos. And I mean, get on Dr. Laura's website. I mean, she does great videos. Watch Dr. Barlow. I mean, get on YouTube and watch videos, and you can pick up tips from people on what to do and what to say. And, and you also pick up things you don't want to do. You'll notice that, bad habits, right? You don't want to pick up. So, yeah. Well, that pretty much rounds us up. So, we just want to say thank you to both Dr. Laura and to Randall. Thank you so much for giving us some time tonight. Thank you for those of you who decided to come in and just give us a little bit of time so we could just give you some information to help you with your practice and just your lifestyle as well. We're here at Ergo-Flex. I want to say thank you to them for allowing us to do this. If you have any questions or anything on any of these topics tonight, you can always call the Ergo-Flex offices, and we will get you in touch with who we need to. I'm always available for any of your questions on any of your equipment or patient needs or implementation of anything with Ergo-Flex. I'm the guy who's going to answer those questions, and I'd be happy to do that for you. That's my job. I love talking to all you docs across the country. I especially love talking to people like when they're buried in snow and I'm like 80 degrees outside. It's pretty cool out there. So anyways, just want to say, Linda Anderson and JT Anderson, the owners of Ergo-Flex, just want to say thank you to everybody out there for attending. We appreciate the support that you guys have given us over the past several years, and we'll just continue to do what we can to help you out during this strange time that we're dealing with. Here in Texas, we're kind of, I think, leading the country and coming out of this thing. We got a bunch of stuff opening up. Doctors' offices went back to full elective surgeries and everything today. By the end of the month, we'll be retail opens back up. Restaurants are supposed to open back up, so we'll kind of see how it all rolls out. So stay safe out there. God bless everybody. And if you have any questions or anything, man, feel free to call the offices and we'll take care of you the best we can. God bless and have a good night, you guys.
Hi, guys. Thank you.
Thank you, Linda.
Bye, Linda.
Bye-bye.
Did you figure it out?
No, how do I shut this thing down?
You could put just leave meeting at the bottom there if you need to.
End meeting. Gotcha. Sounds good, man. Y'all take
All
care.
right.
Good night. Thanks, guys.
Take care.
Bye.
Hey, Doc. See you, Laura.